I'm your host, Steve Turney.
I'm Sarah Way.
And I'm Dr. Ronya Green, board-certified family medicine physician and the owner and operator of Rafa Healthcare and the founder of Care Nexus. And today on The Boost, we talked about integrating behavioral health into primary care seamlessly, as well as how automation and AI can help providers prevent burnout.
You should see the letters after this person's name and stay tuned because this is a riveting conversation. Let's go. Hi, I'm Steve Turney.
And I'm Sarah Way.
And we are so thrilled to be here with Dr. Ronya Green. How are you doing today?
I am great. I'm very excited to be sitting with the two of you.
We're excited to be sitting with you too and get into this conversation. You are the founder and medical director of Care Nexus, and we want to hear all about that. But first, we want to do two quick questions. One is the virtual hug. Tell us somebody or something you're thankful for today.
I'm going to shout out my wonderful husband, Jesse, who holds it down in all the things. So he's awesome.
Holds it down in all the things. Way to go, Jesse, for holding it down. What's one thing you can share that he holds it down?
He's currently holding down the kids right now
Okay.
in their complicated schedules. So between track, gymnastics, dance, karate. So
how many
he's got all
kiddos
the
do you have?
practices. We have two
Two
a
kids.
7 and 8 year old.
Awesome. Okay. Congratulations. And that's a wonderful, beautiful virtual hug. Tell us your shameless plug. Tell us about Care Nexus.
Yes. So Care Nexus is an all-in-one practice management solution for independent providers.
Okay. Good. Well, we're going to learn a bunch more about that. I love to set it up with kind of the backstory. Tell us how you got into medicine generally. You're an MD, and then your pivot to behavioral health.
Yeah, absolutely. So I am a board certified family medicine physician. I've been practicing for over 15 years. Been in the hospital administration space and graduate medical education, residency training, the next generation. But really felt called about 3 years ago to kind of break away from traditional practice. I have always loved the patient journey. I mean, and that is truly what I tell my patients is that I'm on life's journey with you. Life brings you so much transition and I'm just here to walk it with you. But really felt just pressed and not enough time to do all the things that I wanted to do and have all the meaningful conversations that I wanted to have with patients. And so I went from being an employed doc to a self-employed doc and owning my own practice, Rafa Healthcare, where I could fully integrate behavioral health into my practice. Because as a primary care physician, there is not many things that I could talk to you about that don't also encompass the rest of you. And that's really what I wanted and how I practice Rafa. It gives me a deeper meaning and a deeper sense of belonging in my patient's journey. But I also just believe it's much better for the patient that they don't have to kind of segment themselves and decide what they're going to talk about when. With their primary care physician.
Wow. Yeah. We need more of you, Dr. Green.
Oh, thank you. Thank you.
Need to replicate her.
She could probably figure it out. I mean,
Yeah.
the things you build. But it seems like everything you do is full continuum. I mean, the platform you've built, the way you care for patients at Rafa. Is there an identity or a characteristic in you that people point to? Is it grit or resilience, or is it some kind of architecture mindset? What is it about you that lets you tackle these big problems in cohesive ways?
I'm definitely a visionary, so I
Okay.
can see things and see things how they can operate better for individuals and making individuals' lives better, whether that's my patients or my colleagues and other healthcare professionals.
Okay. So you launched out on Rafa Healthcare, and then tell us about the next iteration, which is Care Nexus. How did that come to be?
The next iteration, which is Care Nexus. So Care Nexus was born from my pain point. So again, I was coming into the private practice space with all of this knowledge about how healthcare systems work. And strong operational experience, but I could not seem to have that in my own practice without significant administrative burden. So it was documenting a patient one place, and then having to move them to the electronic health record when they actually became a patient, and then finding another platform by which I could prescribe. It became very burdensome. And I said, there has to be a better way, kind of like how I wanted to pivot away from being an employed physician. And I searched and I could not find one. And so the more I talked to people in the tech development space, they were like, you can do this and put this together. And I was like, oh, so here I am, a tech founder. So definitely was not initially in my cards. But again, being visionary and just wanting to have more time for my patients and reduce the administrative burden. I mean, that is the underlying current of Care Nexus. So Nexus at the heart of what you do for your practice. And so now I'm sharing that with other providers.
That's fabulous. Yeah, that's so interesting. And are you coding it as well? Like, are you building this from the ground up, or what's
I have a development
process?
team that is doing that. Yes.
I wouldn't put it past you to be
I was
doing.
going to say, I wouldn't put it past you either.
I'm the medical director.
Superwoman.
You had your laptop out earlier. I was like, oh yeah, she's all zeros and ones right now.
Don't have that skill set yet.
Okay.
I am the person sitting at the table that says, this is what I want to do. Like, is this possible for somebody to be able to like just schedule themselves for the appointment?
But what did you look for in that partner? Did you shop around a lot, or did somebody just fall in your lap and you're like, oh, ideal partner? How'd that work?
I shopped it around a little bit. So in looking for a solution that was already out there, I learned the slightest bit of tech language to use.
Okay, yeah, good.
And knew how to ask like for open APIs and white labeling.
Yeah.
And so having some of those conversations got me to the place where it was like, oh, you should talk to this person. And then that led me, and really just the reputation of the individuals that I brought into the team and was able to see some of their work in other spaces. And their excitement for building something new. I think that's the fun part, as well as working with someone who can catch the vision and say, oh, we can help operationalize this. So having someone who is going to come along for the ride is a plus.
For sure. Yeah, that's a requirement. What about, so you built it and they will come. Who's it for? Like, do you have a perfect kind of practice? Is it a solo practitioner or a group practice or a big enterprise level thing? Who's it for? Or is it for everybody?
Yeah, so great question. It is definitely for providers that are in the self-pay space or membership-based space. So that is mental health clinicians, eating disorder clinics, physicians, anyone who needs a HIPAA-compliant, safe and secure way to nurture patients into their practice and then manage and care for them, prescribe medications to them, all of those things. So we are definitely more in line with independent providers, but they can be in a group.
Gotcha. Mm-hmm. Okay. Wonderful. And tell us about the patients that you help at Rafa. Is there a certain segment of the population, or do you focus on a certain challenge, or?
So initially, no, I cast the net wide. But what my practice taught me is that I attract other business owners. So entrepreneurs, solopreneurs, or individuals who have teams of 20 or less. That is 90% of my patient base, because they find it to be a great healthcare solution. So yes, I will still take care of individuals who have commercial insurance, but primarily it is entrepreneurs who need a healthcare solution and who need direct access to their patient. To their physician. My patients really love the fact that they can text me, email me, call me. They're not waiting 2 to 3 days to hear back from a nurse, to hear back from me. Like they really appreciate, being able to go in and put themselves on my schedule, whether it be in person or a virtual visit. Okay. So you're not playing back and forth with dates, and we're all busy. And so I think that is the thing that really attracts the patients to Rafa.
So so you've identified that a lot of people who resonate with your service are that concierge kind of kid glove, kind of approach to primary care. And is the private pay sector sort of shrinking or growing, or like what's going on with that ebb and flow? I know it goes back and forth.
Yeah, it's growing in the patient space as well as in the provider space. More and more providers are going in that direction. And then as more people become business owners or just don't have another viable healthcare solution, more and more people are shifting in that direction.
Gotcha. Okay. Fascinating. So tell us about your marketing efforts. This is the Boost, conversations with people promoting mental health. And one thing we talk a lot about is this ability to put the microphone or the megaphone to an organization that's ultimately out there helping people with their own behavioral health. So as you think about your business, like how are you growing it? What channels, what are you trying? Or is it just everyone is flocking to you because you've invented the new mousetrap?
Well, I have definitely grown comfortable with putting myself out there more.
Okay.
Both as, as a physician and the medical director, obviously at Rafa, having conversations, so getting in front of individuals at networking events. But then also, I just love to educate the community. So it's also been fun to have more flexibility in giving talks on various health topics and how people can prevent disease. And disorders. And then for Care Nexus, it's really just aligning with other providers that feel my frustration. So again, I think as much as I can get in front of groups, whether that be in the virtual space and webinars or platforms such as these or just conferences and getting ready to really network and get to know people and understand their frustrations and how we can help them find a solution.
Beautiful. Yeah, I know you're going to be at our conference, at the
I
Mental
am.
Health Marketing Conference. Was thrilled to meet you through that channel.
Yes.
And thank you for sponsoring the conference too. And hopefully see you on stage too. We're in the middle of all that process, going through all those speaker submissions. You sent in a great one. We'll take a quick break, and then I want to go kind of next level with you. We'll be right back with more from Dr. Green. At Term Productions, we craft experiences that connect, engage, and inspire. From dynamic conferences to powerful storytelling, we bring ideas to life through planning, production, and promotion. So your audience doesn't just listen, they remember. Ready to make an impact? Let's build something unforgettable together. Visit turn.productions to get started. All right, we're back with more from Dr. Green, and we want to talk a few things. We want to talk burnout. We want to talk AI, and I want to talk complex systems and challenges that maybe you ran into or discovered when you were working through Care Nexus. Where would you like to go?
Any of those things.
Okay.
Go for it.
Let's go AI.
Okay.
Yeah. What do you think about AI? There's a lot of conversation about it in terms of using it as part of the therapeutic process. But here you are in the middle of the tech world. So what's your perspective on AI?
I use it every day.
Okay.
I do. So I think that AI has amazing tools that can make us more efficient, but it cannot be done without a human touch, right? So I would never take anything AI generated and just put it out there in the world, especially when thinking about clinical care or patient care. But one of the tools that we've been able to integrate into Care Nexus that I love is that AI will read a patient note and then put together an aftercare summary based on what we discussed in that visit. So if we've talked about managing stress, it'll just go ahead and bring in tips about good sleep hygiene and walking and exercising and light therapy. So all of the things that I've kind of trained the AI to do, it helps build the after visit summary. And I love that.
Did you run into any compliance stuff with that, of having to jump through any hoops of sharing patient notes?
Well, there's certainly security and compliance that you have to put on your tech platform in order to be okay with that. But the AI, lives within Care Nexus, and we've been able to train it to hear the physician's voice. So then, and that's for any practice that signs up. So it won't be, Dr. Green's voice that's coming through on your patient after visit summaries, but it learns from what I typically recommend for patients.
Yeah. That sounds so helpful. The amount of times you leave a doctor's visit and you're like, I can't remember all the things that I'm supposed to remember. Yeah. And what a useful way for AI to help you out. Mm-hmm.
Yeah, that's one of the big pains for physicians and therapists is the typing, the notes.
Right.
You get done with a session and then you got to type it all up and report on it.
Yes.
They get behind. So that's just baked into your platform.
You get behind very easily with that. And then people are exchanging their nighttime, the time they're supposed to relax and reconnect for finishing notes. And that is the part that no one enjoys. And so having some of that built in is great.
Are there other aspects of AI built into the platform that you can talk about? Like, is it anywhere, show up anywhere else?
Yeah, so practices can also utilize an AI employee to help them with their phones system. So think about it. If you're a micro practice, a smaller practice, you may not want to hire someone just to answer the telephone. And so there's an AI employee that can be activated and connected to your practice's telephone number that transcribes the conversation. I haven't had anyone yet that complains like, oh my gosh, I'm talking to a robot. But they, just ask questions. What are you calling about today? Do you need help with this? And they transcribe it and send it in the email over to the clinic staff. And we know who called when we were seeing a patient face to face.
That is so cool for like spanning generations, because some people don't want to email. There's all the portals, of course, which for me, I love typing into a portal, but there might be someone who maybe really a grandmother that just wants to pick up the phone and call, and it still talks to you in a way that's through an email.
Right. So. And then, yes, if your practice is small, you still want to be professional and have a phone number and someone, be able to connect with your practice. So,
and somebody is there now 24 hours a day. This is my problem with where I get my hair cut. It's sometimes I'm just on the road. I just want to call. I can't do the whole thing, but I'm I'll just call and see if I can get in. Well, it just rings and goes to voicemail. They don't have it set up. And I'm oh, I just wanted to ask if
no one uses a phone.
No one uses a phone anymore. Yeah.
Steve's got his landline.
I have a super long cord because I'm driving.
But that's a perfect example. So you leave that voicemail, and then someone from my staff goes in and puts you on the schedule and sends you a text message or calls you back and say, hey, Steve, we scheduled you for Monday at 3.
But it's even more wild than that, which is it's hey, what do you need? Oh, I just need to know what the hours are today for your sushi restaurant. Okay, we're open today from 5 to 2. And they don't even talk like robots anymore. Yeah. So is there any other AI that you want to bake in, or that is there any future iteration of this amazing tool?
I've seen really, really cool things demoed with care coordination for patients, right? That are coming with more complex things in visits, or where we're, in our practice, we're fully integrated with behavioral health. So there's conversations regularly between the therapists that my patient sees and myself. And so I've seen some really cool AI tools to be able to combine both of those sets of notes to come up with a care coordination plan for the patient and give them resources. So hopefully that's something that we'll develop soon.
So do you believe this will help address burnout? There's a lot of clinicians, a lot of providers just totally cooked right now. Is this going that direction, or is this the internet where it's oh, it's going to save us so much time, but we're not feeling that yet?
That's so funny that you asked that. I was at a physician leaders conference just last week in Boston, and we had the same conversation because that's what they told us about electronic medical records. And it was going to save us time, be great for and see, I'm from the dinosaur age of medical training, where I actually knew how to write prescriptions, and they know that doctors don't do that anymore, right? So yes, I do think that it's a valid concern, but I think that's why we all need to be at the conversations at the tables when these tech platforms are being built, and really decide how we're going to use AI in our practices. I think the thing that can immediately address clinician burnout is automations. And so those are the things that we've really tried to bake into Care Nexus now, is you sign up to be the patient. There's an automation that automatically sends you the forms that you need to sign before your visit. When you sign them, it comes back. It connects automatically to your chart. There's an automation reminding you of your appointments. It's an automation sending you that post-visit follow-up, asking for a Google review, on the marketing side. So all of those things, I think, can really reduce the burnout and administrative burden, especially for providers who are like me in self-pay practices.
So Dartmouth did a study recently. Have you heard about this? Therabot it's called? Okay. Yeah. So long story short, it was a rigorous, clinical study. And the researcher said it basically provided a gold standard of therapy care in terms of eating disorders, anxiety, these behaviors that we want to see adjusted or developed. What are your thoughts on AI in the practice? I know you touched on it a little bit earlier, but I'm curious.
I'm a little hesitant there, just to speak transparently, because there's nothing that can really replace the human touch? And is the theropod going to be able to read my body language? Therapists like EMDR, CBT, like they're very highly skilled to be able to help patients navigate difficult circumstances and situations. And so I do worry about that piece of it, that it's a little too robotic, if you will, and may not really be able to get to the crux of it. Like, is the therapist going to know the next question that needs to be asked, like a skilled therapist would?
I mean, it could read body language. Like it could know if my eyes dilate, or it could, see if I'm sweating, or if I have a pulse, like if you have a camera. My biggest concern with AI is how easy it is to lie to. And, humans are also that way. Yeah. But like when my daughter uses AI, I'm always having her feed it misinformation. So it's always like, hey, I'm a middle-aged woman in Nebraska, because I'm like, I don't want you to know who this girl is, So it's a hiding in plain sight concept. And humans are no different. I can lie to my therapist or not be ready to tell something to my therapist. We had a guest on recently who just said, I wasn't ready to talk about that. But joke's
on you. I think the AI probably knows who you are, even if you tell it someone else.
Well, just now I outed everything, my whole strategy.
Our phones are all listening to us right now.
So, this is the guy who likes to pretend.
Yes.
And here I am, like a grandma from Maine, thinking I tricked the system.
On your landline.
I didn't
know that calling and making appointments.
I didn't know that it read body language, though, because I was hearing a little bit about it too. But I like what you're saying about like the human touch. It's not just hearing the words; you're reading that person's body language and the way that the way they're saying the words.
Yeah.
But if it reads body language too, that's interesting.
Yeah. Or what if, if you train a camera to me and then it analyzes, different signs, but also what about the reticent patient? Like, I don't want to tell this to a person. I know somebody who is very much that way. Like they would much rather talk to a computer than a person, because it's kind of scary. It's like, it's a lot to walk in there. Yeah. So I don't know. I know we don't have answers here, but I appreciate your candor and your nuance, because you're at these conferences and talking with your peers about it.
Yeah, absolutely. I do. At this point, obviously, it cannot be ignored. But I do think that we should be adopters of it and grow and change with it as it evolves.
Are you typically an early adopter? Is that something you think about?
I wouldn't describe myself that way.
How would you describe yourself?
Yeah.
She's a visionary.
Visionary. Yeah.
I am open-minded and very curious.
Okay.
I am curious about just behaviors and how others think. And certainly don't have to transfer that to myself as to how I need to show up or behave. But I guess I'm just open-minded, and I tested it and I was like, oh, this isn't so bad. And so I do other things. And I was like, okay, this is good.
Yeah, I love that. So there's a bravery in there, really, I think. And let's talk about the ability to look a complex system or problem in the eye and say, oh, I think I might just explore this and be curious about it, instead of like, oh, that's scary. As you were building Care Nexus, like what was that process like? And was there a specific obstacle or challenge that kind of came up for you along the way that you tackled or had to overcome?
It is scary in the sense that, you're gambling on yourself, just like we were talking about earlier with physicians making the pivot from an employed practice to a private practice. So there is some fear there. I certainly acknowledge that. And for me, it's been acknowledging it weekly sometimes. But there's a hope, right, that a system can be better. And I'm hopeful for the payer system as well. But that is certainly much more complex to unwind there. But I think that it's hope that really can drive us forward to want to remain, on the front lines of change and advocating for change. I think our patients deserve that. There are people that deserve that. So.
Yeah. Yeah, I sat at a mental health technology conference like not very long ago. It was maybe a year or two ago. And it was like a well-known payer. And they said, oh, we're not even set up for contracting value-based care yet. Like, it's a ways off in some instances. It is hyper complex in terms of the payer relationship with providers. I don't know if you have a take on that, but.
I agree that it's highly complex and can certainly be better. There are just so many layers
Yeah.
when dealing with provider systems. And for me personally, the frustration is I know that I can deliver this care more efficiently and less costly than what is being presented. And I get it, because again, I've been to business school as well, so I understand that background. Like, you have to charge to cover all of the expenses, but there are so many layers, and so I think that is the barrier, and really just getting to the heart of like, who do I need? Who can I work with to really drive this thing forward? Whatever it is, whether it's opening up my own practice or building a tech platform. So I think the biggest complexity really is wading through the layers and untangling it all.
Are you an optimist?
I think I am. If I was with my physician colleagues, they would definitely point to me as the optimist.
I think I would too.
In the group, because I think.
Yeah.
I think some people have just kind of, said that this is what it is, and we'll just have to kind of find our niche in it. But I'm still hopeful that things can be better on both sides.
Yeah, that's the word. Hope. You said that a number of times. Yeah.
I was kind of thinking of how lucky your patients are too, because coming to someone who can then address not just the primary care, but then talk to them in a way in behavioral health and be able to connect them with the people they need, so they're not having to run all over. Because I think the problem is the continuation of care.
Yes,
is an issue.
I think we really went wrong when we tried to segment it and say, I take care of this and this person takes care of that. And it pains me when people look at their own health and wellness that way, like, oh, this is for my mental health and this is for my physical health. There's no separation. And I talk about that all of the time. And so, yes, I mean, we can talk about, and it doesn't have to be like a mood disorder issue. It could just be sleep or stress or what, it could be your blood pressure. Like, how are we going to address the micro and macro aggressions that you're facing every day that are showing up in your body? And so having some of those conversations, and I recognize for some of my patients, those conversations are very new. And I also recognize that some people aren't ready yet to have that, but sometimes I'm planting the seed, sometimes I'm watering the seed, sometimes I'm pulling up the weeds around the seed. Like, you got to be open to it.
Do you feel yourself having to define the difference between mental health and mental illness to your patients?
Yes. Frequently. And very much like normalizing therapy. Everybody can benefit from therapy. You don't need to be going through any sort of crisis, traumatic experience. You need a check-in. And so trying to really connect them with the therapist that I feel like is best for them, right? Just like I'm not the physician for everyone. Maybe a particular therapist who I love is not for that particular patient either, but connecting them with someone that they can talk to at different places on their journey.
This is fascinating to me. Could you talk a little bit more about where you see the consumer in terms of adoption of mental health? Like, this is so interesting to me, and maybe an aspect of either education or like this is what I'm seeing in mental health is like, now that we're talking about it, a lot of people are deferring to the clinician really heavily, as like, oh, fix my problem, or like, finally we're getting there, but like, are we outsourcing our mental health to clinicians when some or all of that needs to be sort of under our own individual care? Does that make sense?
It does.
Okay.
I think that people fall all over the spectrum with this, but what they share in common is that they want a solution.
Okay.
So have individuals, and I think we all learned that like through the pandemic. There's been numerous case study reports that show how the diagnoses of ADHD has increased in adult ADHD since 2020. So people are, coming like with their question and very much like using the buzzwords. Is it ADHD? Now is it perimenopause? Like, what's going on with me? So everybody has a question, but how willing are they to accept what the different options could be and what therapy looks like for them? And by therapy, I just mean control of that process, control of the symptoms that you're experiencing, right? And so being able to talk about whatever you're experiencing as a continuum that might flare at sometimes more than others, depending on what circumstances you're going through, what environmental or social changes you're experiencing at that time, versus then looking for this like panacea where nothing is wrong. So I think everyone is looking for an answer, but people are at different ways on that. And so I have people that are like, just prescribe me the med.
Yeah.
I have people that are like, I want to know everything that's wrong, do all the blood work, like everything. And then I have other people that are like, I'm just going to walk it out. And I'm like, this is great. Let's do that. I think the onus is on me as the physician. And I think other providers and physicians need to just be aware of that and being willing to counsel that person wherever they are on that journey.
What's your perspective on outcomes? It's like it's a little easier to see when a hip transplant or, it works well versus, outcomes for different modalities across mental health and behavioral health care. Help us understand some of that cloudiness or the progress that you're seeing.
Yeah. Well, I think it's still very subjective, right? So we have tools. I'm preaching to the choir here, but like we have tools where we can look for different scores, ASRS or PHQ-9, GAD-7, and we can revisit those at certain times. I do think that they need to be repeated frequently, depending on where someone is in their journey. But because the tool is the thing that I think brings the objectivity into it, right? So you can describe it to me, and part of your description is going to be based on whatever you're experiencing that day. But I think utilizing the tool brings objectivity into it. But how we create a care plan around that, I think has to look different at different times. So it's not as black and white. It's not even like diabetes. I mean, I can track your A1C and see exactly how well your blood sugar has been controlled.
Yeah.
But I think we have to be okay with sitting in the nuance and the subjectivity of some of those outcomes as it relates to mental health.
Yeah. And how can we get better with our data? Like, do I live in a food desert?
Right.
Like, do we know that at all? Like, what is CMS kind of asking us to track or,
Yeah, it feels so different, like what you're saying with diabetes. Like you can quantitatively track numbers, but with mental health, how can you like qualitatively use that data? It's a little more challenging.
Right.
Yeah. Well, as we wrap, 2 more questions for you. One is there anything you're doing for yourself lately, kind of your own personal boost that's working for you that you'd be up for talking about when it comes to your mental health or your own health?
I love getting outside to walk. So I think the midday walks, I usually do the gym in the morning to start the day.
Nice.
I think a midday walk is important, especially now when we're in so many virtual meetings or just trying to get things cranked out and deadlines. But a virtual walk, a walk outside really helps get my day
Nice.
going.
Being glued to the screen is the worst. You got to get up. You
Yeah,
gotta get
move
away from
around.
the screen.
And it's easy to do.
Yeah.
And finally, is there a piece of content, which could be a book or an album or a song you're just vibing with? Is there something you're like taking in lately?
My favorite book that I just recently read is Rewrite Your Rules by Morgan DeBon. I loved it because it was the best mix of advice and then very like practical steps that you can take. She's an amazing entrepreneur and also in the tech space, but I really feel like the tools that she gave could be used for anyone. So I love it. And so I've been going back to it at different places.
Sweet. We'll put that in the notes. And thanks for coming on the show. It's a real delight to talk with you, Dr. Green.
Thank you so much for having me.
I know I'll get to see you in October, but it's great to see you here.
Yes. Looking forward to connecting in October.
Sounds good.
Yeah.
Till next time.